Well, good morning, everyone. Jessica Larche here with News 3 this morning. So good to be with you on this Wednesday. And this morning, we are joined by News 3 medical expert Dr. Ryan Light to help get our back to school health questions answered. Good morning, Dr. Light.
Morning, everyone.
We are so happy to join you. We have tons of questions, and so we have the man here with us this morning. So we want to help parents, families really get into the swing of the new school year. And there are a lot of health questions, as you can imagine, as we head into the school year. So please drop your questions right there in the comment sections here of this live so I can go ahead and get those questions to Dr. Light. So I'm going to get to those questions in just a moment. Whatever's on your mind that you want to ask the expert, go ahead and put it in the comments. But I have some questions that we can ask on your behalf to get us started this morning. Dr. Light, of course, COVID-19 on everybody's minds. It has been for the last 2 years as the kids are heading back to school. We know that the CDC relaxed many of the guidelines in the classroom. What should parents really be concerned about as we head into the new school year when it comes to COVID?
Well, when we're looking at these guidelines, the CDC was looking at what's the risk to children. Is it better to in-person learn without a mask, less social distancing? And I think they came up with the conclusion that the risk is higher for in-person learning to do that right. So when we look at COVID, we know that this is going from a pandemic to an endemic, meaning that it's going to be around for the rest of most of our lives. So we got to learn to live with it, and it's not causing serious injuries or serious illnesses, and it's not very many deaths in the children. So that's the reason we want to get back into in-person learning and relaxing some of those standards so they can learn a little bit better.
In terms of immunity, we've talked about herd immunity a lot between those of us who are vaccinated and people, so many people having had the virus at that point. Have we reached that herd immunity stage, which is allowing the CDC to relax those guidelines?
I think we have, reached some herd immunity so that it doesn't travel as fast. A lot of people have had at least the vaccination or had natural immunity. That prevents us from getting seriously ill. It also prevents those deaths because when you get exposed to a different variant, you already have antibodies, so it's easier to fight it off. It's less severe. As we see these new variants, they're less severe in their illness presentation as well, versus the first ones that came out. So, I think it's time to move back to normalcy as much as we can get to.
I know there are still some hospitalizations. There are still some deaths when it comes to COVID. So that's kind of like where we're torn. Many of us who are contracting the virus right now, as you said, it's very mild. We're doing fine for the most part. Some people have some long haulers issues, but for the most part, if you've been vaccinated, you have some immunity. It's not as devastating as it was at the start of the pandemic, but we are still seeing some of the extreme outcomes. What should we be doing? Should we still be wearing masks if we're concerned? Should we abandon them altogether? Or is it just a personal choice of what you want to do to protect yourself?
I think, when we said it's a personal choice. I mean, if you're concerned about the virus or you're concerned about serious complications, then wearing the mask, nobody's going to judge you if you do wear a mask. Nobody's going to judge you if you don't wear a mask. It's kind of a personal decision that's out there right now. It depends on, maybe you've had COVID already and you believe that the natural immunity will protect you against the newest strains that are out there, whether you've had the vaccines. I think that people are relaxing some of those things, and that's why we still see spread. However, if you're in one of those high risk groups, you still are at high risk. But we have good treatment options out there now. So you have 5 days to start some of the medications. So if you start to have symptoms, go ahead and do that at-home test, find a positive COVID test, and get in with your PCP so you can get that medication if you're really concerned about serious complications or illness, or getting the illness getting worse.
Now, as the babies head back to, I say babies, I'm talking about middle school, teenagers, all of that. But as the kids head back to school, um, should we still be making sure we're looking at things like hand washing, sanitizing our hands, those small things we can do to help mitigate the spread of any virus?
I think those are the most important things. I mean, it's going to prevent flu. It's going to prevent these common colds. When kids go back to school, it's a petri dish from everybody coming from across the country back into the same area. We know that, the first couple of weeks of school, everybody catches a little bit of everything. So that's just going to help prevent it. So I think that's the best medicine is to prevention and good hand hygiene. holds true throughout all the viruses that are out there. So let's make sure we're washing our hands, coughing and sneezing into your elbow. And if you're sick, stay home. I think that's still one of the most important things to do.
Yes, yes, we should definitely be following that advice more. I was talking to a friend, and before the pandemic, you think if you had a cold, a lot of us would still show up to work. We were afraid to lose sick time. We were afraid to lose vacation time. We were afraid to think, oh my God, are my managers going to be upset if I don't show up to work today? But I do think we're a lot more mindful now that if we are not well physically or mentally, that it is okay to stay home.
You probably see as businesses, it's been more productive when we keep sick people out of the workplace so that they're not coming in working sick where they're not as productive and, they're not giving everybody else the same stuff. So, we're passing that virus around so that everybody else is sick. So I think that that's why businesses are more mindful and saying, hey, stay home. We don't need you here. Work from home today.
Doctor's orders, everyone, to the bosses out there. Doctor's orders. If your employees are sick, stay home. And you too, if you're sick, stay home. One of the other things we really need to talk about is monkeypox. People are freaking out. We are still learning more about it. It seems to be just a very painful virus. While we know the death rate is not extraordinarily high from monkeypox, it does again appear to be a very painful, very visible virus. I'm concerned about the level of community spread that we're going to see when kids go back to school. So, what should we be thinking about, especially the kids in school, to help mitigate the spread of monkeypox?
Well, when we look at monkeypox, spread in school would be open lesions. And I'm hoping, what we just talked about, if you have monkeypox, please stay home. If you think you have monkeypox, stay home. There's a prodrome area where for 3 weeks, you may not know you had it, but you'll have like flu-like symptoms about 2 or 3 weeks earlier, and then you can get the symptoms, and then the virus shows up with the lesions. But if you have those, please stay at home. If you're a child, please don't touch any other lesions. I mean, that's just good hand hygiene. Just if somebody has a lesion on them, please don't touch them. And it's close contact for a larger exposure. It's not like you walk past somebody in the hallway, so it's not as contagious as like COVID, where you could get it by walking past someone, being around it, and you don't have to have as much contact. Monkeypox takes a lot more really close contact, and hopefully no one at school is having that close of contact. So I'd like to say for children out there, keep your hands to yourself. That's probably the best medicine when we come to monkeypox, because you're probably not going to be that close to anybody to really can worry about it in the school situation.
I want to talk a little bit more about monkeypox because there are there's some misinformation about how monkeypox is spread. We know one of the primary ways, and listen, I know parents are on this Facebook Live, so we can talk about this, but I know one of the primary ways that it's been seen is through sexual contact. However, monkeypox is not an STD. So this can be transmitted, as you said, long-term exposure, physical contact, but that doesn't have to be sexual contact. So can you kind of talk about that again, just so parents understand if, if you're around a family member for a long period of time or prolonged, are we talking about prolonged hugs, or if the kids are playing on the playground and that's prolonged? Are those areas where we could see monkeypox spread in a school environment?
You would probably still be highly unlikely. I mean, it would be touching an open lesion, and that's where, I think we tell kids in school, keep your hands to yourself, don't touch other kids. So that's always good. Hopefully nobody really is in that personal space, because it's really in that tight personal space that we're really talking about. I know kids get kind of close, but we should try to keep a little bit of that distance, that social distancing that we want, or a little bit of physical distancing. That also prevents head lice, which we know comes quite commonly in this school year. So, when we really look at it, having that arm's length from anybody probably most likely would keep these children safe. So, we don't need to be hugging and holding hands in the hallway in any school situation. And I think that's where we would just be, hey, let's just keep that arm's length for everybody, and we'll be much better off.
I think that's a good point that you said about the holding hands in the hallway thing. I mean, I know, like, especially in elementary schools, if they're trying to keep a line together, all of the kids will link hands and, walk down together. So should we be reconsidering things like that, especially for the little ones?
I think they would probably be wise. I mean, like there's no reason for them to be holding hands. That this is, transmitting any virus that may be on your hands, whether that's COVID or whether that's Corona. hand hygiene in the littlest ones where we're holding hands to try to keep them in a line, that's a little bit more difficult. So I don't know how to explain that to teachers, but maybe we just ask them to have imaginary hand holding or something, or hold on to a very small piece of string or something like that, or a piece of yarn, have knots on there, and they're just supposed to hold it with their fingers, and that would prevent some of that transmission through hand-to-hand contact.
Last thing I want to ask about monkeypox when it comes to the school environment. I know at the height of COVID, and there's a picture of me somewhere where I'm wearing a mask, gloves, goggles, everything. So should we be considering wearing gloves in a school environment to help prevent that, especially if the little ones aren't washing their hands like they should?
No, I don't think it's not transmitted that closely where, you touch one object and they touch another object. So what the biggest one is the biggest one is what we learned from COVID: contract tracing, contract tracing, contract tracing. If somebody comes positive, we're contract tracing everybody they came in contact with, testing everybody and isolating those people. I think that COVID gave us that tool where we really expanded our public health departments to really contract trace. And I think that's why it's kept under wraps as much as possible, because we can track it down much faster. This virus doesn't spread as fast, and we do have a vaccine for it right away. So if you had come in contact with somebody and we think that you may have it, we can vaccinate in that 4-week period before you actually get monkeypox, so we can slow this one down. So it's a lot less worrisome as COVID when we didn't know what was going on. So this is not something that we're not prepared for, because COVID prepared us very well for these viruses. But that's why I think that it won't be as extreme, and we don't need those gloves and masks as much. But if you're concerned as a parent, you can always have them wear them.
I lied. One more thing about about monkeypox. We've also seen some misinformation that if you're vaccinated against chickenpox, or if you've had chickenpox, that makes you immune to monkeypox. They are not related. That is not true, right?
They're not related. Monkeypox is closely related to smallpox, and we stopped doing smallpox vaccinations inside the United States around 1968. So if you were born for 1968, you may have some protection, but after 1968, none of us have really been vaccinated for it.
Okay. And then high risk in terms of the monkeypox vaccine, that's going to be high risk populations, people, maybe elderly people, people with compromised immune systems. And so they would need to talk to their doctors about asking, hey, should I be trying to get the monkeypox vaccine?
Yeah, those are the high risk groups. So, I mean, I think you said it best, which those people who are going to come in contact with it. But when we're contract tracing, those people will also be vaccinated if you had a high risk exposure. So if you get contacted by the health department, they'll set that up for you, and then set you up for the monkeypox vaccination, which is really a smallpox vaccination as well. But it's been FDA approved. It's been on the market for years. So this is not experimental use only. This is an approved vaccine. So we do have some protection. So that's why we shouldn't sweat this one.
Got it. Got it. Alrighty. While we're talking about that, let's talk about cold and flu season. We have been spared from having some really rough cold and flu seasons since the pandemic, because we've all been wearing masks and staying 6 to 10 to 20 to 30 feet apart. But as the kids say, we're back outside now. We're all at parties, we're at gatherings, we're taking trips, we're in large groups of people, which means the viruses are going to be spreading more. Do you think that we're going to have a rough cold and flu season, and how soon should we be getting the flu shot?
Well, it's an excellent question. We always look at the models out of Australia. Australia had a greater than normal flu season, so it was pretty high. The big thing is it happened much earlier this year than it normally does. Usually their peak is in June. It actually peaked in April, which would be consistent with us peaking in October. So I think that we may see worse than the previous 2 years at least, and it's consistent with a couple of the years that we had going back 3 to 5 years. So it's greater than the 5-year average right now. When we look at it, flu season, when you look at flu vaccines, you have at least 3 weeks from the time you get vaccinated to the time you have immunity. It's kind of like COVID. We said wait 2 weeks before you after the last COVID vaccination to have protection. Flu is 3 weeks, so from the time you get vaccinated, it's 3 weeks. So if we're going to see similar things, and I can only project from Australia, is that we may see our flu season in October, November, and December. So some people always say, I don't want to get it too early because it may not last through the whole season. I think that, the September timeframe, this first right after Labor Day here, will be one of those things where we need to really start considering getting that flu shot so that you'll have that protection rolling into October 1 in case it is an early flu season.
Okay. Really good. Look, I'm making a calendar reminder right now to to check in about getting my flu shot that first week of September. That's really great advice. It gives us a deadline, and we definitely need deadlines to make sure we get things done. One of the other things in terms of overall health that kids are thinking about, parents are thinking about as they head back to school, is mental health. We're talking about the pressures of them trying to make up for the learning loss during the pandemic, just the social pressures of being back in the classroom, bullying that can help happen, that can also impact our kids' mental health. So, what things should parents be looking out for? Some telltale signs in their kids, and if there's a mental health need, you as a doctor, their PCP or their pediatrician, they can recommend mental health professionals to help their kids out. That's right.
Yeah, I mean, when we look at going back to school, it's a stressful time for parents as well as the children. So trying to get them off to a good start. I mean, that's conversations you need to start having now, where you open up those communication lines. Be supportive about it. Hey, if something happens, it's a new school year, you're around new people. That transition from fifth to sixth grade, elementary school to middle school, or middle school to high school. Those are really stressful times because it's a totally different change of what you've done for the last few years. What you're looking for in your kids is that they're withdrawing from you. If they're having unexplained illnesses, one of those is like headaches that are frequently, stomach aches, even chest pain. Chest pain is uncommon. Those are signs that they may be asking for help. So that's where you really have to divulge into. It may not be a medical condition, but it may be more a mental health issue or something's going on at school. If you're concerned and they're not willing to talk to you and you still have concerns that they may have been withdrawn or they may be lashing out in anger, take them to your pediatrician or your PCP, have them take a look at them. We can diagnose any of the illnesses that may not be there. If we don't find anything, a lot of times we open that up to the mental health concerns. And that's where we can kind of divulge down into it. And sometimes if they're not willing to share with you, a lot of times they may actually be able to talk to us about, hey, I'm having some struggles. And then we can get them some help. And we're kind of an intermediate in between the parent and the child so that we can explain to the parent so the parent doesn't get angry that they're having these symptoms. But that's the best things that we can do for them. And I think we can keep a lot of these children out of trouble. But just make sure you're watching this first few weeks and prepare them and ask them how their day went every day. Because I think that's the most important thing. And if you start seeing a change over these first couple of weeks of school or in the third week of school, then you can really get on top of it before it gets really bad. And we can prevent those teen suicides and things like that.
That's so important. The lines of communication, knowing kids knowing that they have a safe space to talk with their parents, with their doctors, with therapists. Therapy is normal, it is needed, and it is life changing. I'm a huge advocate for that. So thank you for that reminder this morning too, Dr. Light. We also want to talk about what our kids are eating at school. We know how important nutrition is. We also know that parents have a lot on their plate, and sometimes it's easy to get whatever's cheap and processed, throw it in there, send the kids on their way. You don't mean them any harm, but you're just trying to get everything done for everyone. But knowing that, what are some things that parents can think about now to prepare healthier lunches for the school year? What are some things that you'd want to include in their lunch boxes?
When I really look at it is if you can find that vegetable that they really like to eat or prepare it in a way that they like to eat it. Because vegetables, anything that has color in it actually carries a lot of antioxidants. We talked about it on the shows before, where those things are all what makes us healthier. A fresh piece of fruit every day, whether that's half an apple or whatever it is, that apple contains in the peel of it, it contains a lot of antioxidants. It contains the vitamins and minerals that we need. It's not ultra processed, so it's not going to your brain, and it's really good because it slowly dissolves and gives you the sugar over the school day. If we feed them a much better, healthier lunch, then they're going to perform much better and they're not going to have that sluggishness after lunch. And that gives them a better educational opportunity because when we feed them ultra processed foods, those go right into sugar, and we give them a sugar high for about 30 minutes and then they crash for the last half of the day and they just want to go to sleep. I think we all experience that when we eat too much sugar. So it's one of those things where trying to find those snacks that they really want that are healthy for them, the vegetables and the fruits, and some protein in there. And I think that you're golden if you can do that. If you have a picky eater, find what they like to eat and see what you can make healthier choices or try to steer them. And that's where you can start experimenting with it now, so that when school comes around, you're not trying to figure it out when you're trying to get them on the bus, trying to get them off the bus, making sure they're doing their homework, because that's not the time to do it. It's time to do it right now. Like, hey, what would you like in your lunch? Do you care to try an apple? And I think that that would give us the best opportunity to get them set up right so that they're feeling good with their nutrition at lunchtime, and you transition them into the school year as well.
Yes. As parents and adults, we should be also taking that advice for ourselves. Listen, I know everybody's got a lot on their plate. We're all very busy, and we don't mean any harm sometimes when we're making those quick decisions. But if we can start making better decisions now, as you said, it'll set us up better for the rest of the school year. I want to take a quick moment and just check to see if we have any questions in the chat here. I think I saw a couple. Let's see here. I'm double checking the chat. You guys don't laugh at me. Apparently, I'm getting my technology together. Hold on one second. I think we had a question. Someone asked if, let's see. They asked if hand sanitizer should be added to school supply lists. Dr. Light, what do you think about that?
I think we should be using hand sanitizer. That's quick and easy. We know that it helps prevent some of those viruses. We know that good hand hygiene helps prevent the flu, the common cold, as well as COVID. So when we really look at it, hand sanitizer should probably be on that list. If they don't have it on the list, make sure your child has it. We have to be very careful with the younger children, those kindergartners and first graders, because, we don't want to consume it. So it is alcohol, so we don't want to consume too much of that. So we just want to make sure that we're washing our hands. And hand sanitizer, even after you use it, does last for several hours after that. So that alcohol is still on the hands, so it does prevent bacteria or viruses from developing on the hands over a period of time.
I feel like I have gallons of it, honestly. Here at home, we just keep refilling the bottles, putting it in. I think I have at least a tiny bottle in every purse just to make sure we have it. Is there any danger in overusing hand sanitizer on our hands?
Well, I mean, the biggest risk from it is, consumption of it, where you're eating right afterwards and you haven't allowed it to dry. Most of the time, the alcohol is going to evaporate onto the hands. It's going to leave the residue from the alcohol. Alcohol is very drying to your skin. So if you're seeing that you're getting a lot of dryness, having a lotion in between may help out as well, just to keep your hands from being overly dry. Yeah, I know that when we get to the wintertime, our hands always get a little bit more dry as the weather changes. So just be careful of that part. But for the most part, is at least allow it to dry before you start to eat or consume anything with it.
So I'm checking to see we don't have any questions just yet, but if you happen to see my conversation with Dr. Light after we've logged off, please still leave some questions in the comments, and that way we can get them to Dr. Light and get them answered for you throughout the school year. Dr. Light, before we let you go, because I know you've got patients to see today, before we let you go, can you just tell us about, as a parent yourself, looking into the school year, what would be your number one piece of advice to parents to help keep your kids healthy this school year?
When I really look at it, right now is the time to get them back on a regular bedtime schedule, to get that regular sleep so that we can get them staged up, because my kids have stayed up much later than we normally allow them to stay up all summer. And they like to sleep in until later than that school bus is here. So, like day one, I don't want them rolling out of bed with their hair all a mess. Not mine, of course. But when day one rolls around, it's really wise to have them on a regular bedtime schedule. One of the things that you can increase is zinc and vitamin C. We know that helps prevent some of these community spread viruses, common colds and stuff. So that may be wise to add in there as well. And then making sure that they've got their vaccinations up to date, because there are still childhood diseases that are out there. So just making sure you check with your pediatrician or that annual well visit, just to make sure that your eye screening and your hearing screening, that's going to set them up for success, so that it's not a visual problem, it's not a hearing problem. They're up to date with their vaccines, so we're keeping them from being sick. And then, making sure they're getting good sleep and eating healthy at lunch, as we talked about. I think you got success there.
All right, so I'm going to give a recap for everyone watching. Our advice from our medical expert, Dr. Ryan Light, is to make sure your kids are getting on a regular sleep routine, zinc and vitamin C to help fortify their immune systems. Let's see, making sure you're up to date on your vaccinations, wash your hands, and keep your hands to yourself. Does that sum it up, Dr. Light?
I think that's good suggestions for us all, though.
Yes, for parents and adults alike. Dr. Light, thank you so much for joining us this morning. We really appreciate it.
No problem. You guys have a blessed day.
All right, you too. We'll see you later.
Bye.